Hello, Jackie Montefiore here, GP and founder at Sante Medical. I just wanted to make this video to answer a few frequently asked questions. So here we go. How do I know if I should come to Sante Medical? Well, first and foremost, I'm a GP, so that's what I see as my primary role. So if you have any GP related complaints or things that you need to get sorted out, by all means, come and see me and I can help you out with any of those. My main special interests are in diet and lifestyle interventions to try and help improve chronic diseases. And I also have a bit of an interest and some extra experience in skin cancer medicine. But I like to think I can help with most areas of general practice. So anything GP related, you're more than welcome to come and see me for. Like I mentioned, I have that special interest in diet to improve chronic diseases, and primarily I do like to use the low carb diet. And that seems to help an array of different conditions. And so some degree of a low carb diet is usually what I'd suggest, but it's certainly not the only thing we discuss in a consultation, and we certainly look at other measures that can help improve conditions and symptoms and that sort of stuff, and basically achieve your best health. So hopefully that helps clear that one up. What if I don't want to do a low carb diet? Well, that's okay. I won't force you to do a low carb diet. I do believe some degree of carbohydrate restriction is the best approach to take if you really want to live a healthy lifestyle. I think we just have so many refined carbohydrates in our food supply, and by and large, I don't think they're doing us many favors for our health. They're easy to consume. They're somewhat addictive. They give us a rise in our blood sugar and insulin, and over the long term, that does our health no favors. They also don't provide a lot in the way of nutrition in terms of being dense in vitamins and minerals, and that's another reason why they're not very filling or satiating. So other more nutrient dense foods that just naturally are lower in their digestible carbohydrates tend to be more filling, and so I will normally recommend people choose them wherever they can. So are you a functional medicine doctor? So the short answer is no, I'm not trained in functional medicine. The longer answer is I do have some interest in some of the areas that cross over with functional medicine. So for example, in certain situations, I will recommend, certain supplements and other measures that might help with a certain condition. And some examples of those are sometimes with heart disease, I'll recommend, the conventional treatments of medical management of statins, aspirin, blood pressure control, but then I will often recommend other nutritional measures that have pretty good evidence, like fish oil, magnesium, and other things, depending on the situation, and there's quite a lot of nuance involved. So there is a little bit of overlap there, but I wouldn't call myself trained in functional medicine. I'm an allopathic, mainstream trained GP, and that's where my practice and experience is, and so that's where I practice. And, obviously I need to practice in the areas that I'm trained and confident in practicing in. So sometimes I get people come and ask me, will you treat me for this condition, or say something that's a bit of an obscure diagnosis, and the answer is I don't treat conditions made by another practitioner. I tend to start from square one and sort of assess you myself and run the tests that are most appropriate and then guide you based on there. So the answer is no, I don't sort of blanketly treat for a diagnosis that another practitioner's made, whether that be like an alternative practitioner or another mainstream GP. I'll assess you in my own right and give you my honest opinion of what I think is the best treatment for you. Another question I get asked is, will you write me a meal plan? I will write you some ideas of foods to include on a regular basis on your diet, but I don't prescribe amounts and exactly what to have when and what day. I find long term that's not sustainable. And to be looking at amounts, generally one of the beauties of following a low carbohydrate, higher healthy fat or natural fat diet is that it is really good at triggering your body's own full signals, and then you get a lot better at listening to your body's hunger and full signals. So I will normally guide you towards an array of foods that would be better to eat, and that would be usually based on what you eat at the moment. But I find it's not a great use of my time and the consultation to be, spending a long time working out a meal plan for you. And if you really, really want that, again, I can give you a guide, but I will often refer to some of my dietitian colleagues for a bit more advice on that. And I just find that's a better use of my skills and time. So the general answer is no, I don't provide a written meal plan per se, but I'll give you some advice on what foods to eat and how to structure your days and your weeks. And because it's not a matter of just following this meal plan for 7 days, 10 days, 21-day challenge, you need to adopt a change that you feel confident in sticking to in the long term. And you need to find a way of doing that within your own lifestyle. So I hope that answers some of the more common questions that people might have. And if you have any more questions, you can always call the clinic. The staff are fantastic and very knowledgeable. And hopefully I will see you soon. Okay, bye.